The human spine is the most important component of the body that supports and absorbs all kinds of stresses coming from the limbs of the body. These stresses are then equally redistributed to the small and large musculatures of the spine. The base of the human spine is the sacrum. It is the foundation of our body, where the entire weight of the body is balanced and supported. The body stress is mainly absorbed at the natural curvatures of our spine. At the cervical region, it is at the mid-cervical and lower cervical bodies. And at the thoracic level, the stress is at the 7th or the 8th vertebral body. In the lumbar region, it's at the lower lumbar bones or at the apex of its curvature. The human body is made up of 7 cervical bones, 12 thoracic bones, 5 lumbar bones, 5 fused sacral bones, and 2 to 3 coccyx bones, which is known as the tailbone. The entire spine is responsible for the stability of the body. While we walk during activities and sports, the spine automatically adjusts to the stresses and the strain that we put onto it due to its natural curvature. The vertebral bodies take the shock as shock absorbers. The disc is a structure between 2 vertebral bodies, which are called as shock absorbers. The outer ring of the disc is rigid and cartilaginous, and the inner is less point. As we go on stressing our body and the spine, the weaker areas of the disc gets more and more stressed too. The smaller muscles around it becomes imbalanced and in its texture. These imbalances in the small musculatures cause uneven stress on the disc. Over a period of time, the disc starts irritating the spine or the spinal cord. When this takes place, the muscles around it gets into spasms and cause aches and becomes painful later. Eventually one day, when the disc encounters sudden stresses, like coughing or during sudden movements, the outer ring of the disc gives way, and the inner viscoid fluid oozes out to cause compression to the spinal cord or its roots. And we call it prolapsed disc or simply slip disc. It's a very painful situation.
Today we're going to speak about the shockwave therapy, which is now a common therapy in physiotherapy world. Apart from this shockwave therapy, everybody has known that it's a very painful therapy. And we have here an instrument that has come from America, which gives you shockwave therapy without pain. It's a very simple machine to deal with. In fact, at a touch of a finger, this machine is incorporated with the computer, and it will give us, we start it this way, and we will get the main screen, which now deals with the analysis. Now say for instance, we have a subject, and in the subject we have small muscles which are attached to the vertebra, right? And the small muscles that are attached to the vertebra are the one which takes up maximum stress of the body. When we move, when we walk, when we have activities, all the stress is actually directed to the spine. And from the spine, the stress is directed to the muscles around here. And those muscles which are first directly encounters the stress are the small muscles, especially the spinous muscles, the adjacent spinous muscles. These adjacent spinal muscles are the muscles which will take the stress all through. Now, what happens with this analysis system is that if we have, say, to analyze a thorax, so what we will do is to identify the thoracic muscles, which are segments, which are taking care of the pressures at the segment point. And in the spine, we have these spinous processes on the side, or the transverse processes of the vertebra, and each vertebra has got its small muscles attached to it. But these small muscles are the one which takes all the stress, especially when activities are taking place in the body and the body transmit all the forces to the spine, and when that happens, we have these little small spine muscles which get into some kind of a stress. The spine picks up all the beatings of the daily activities, and when you realize that there are small muscles at the spine which take up maximum beating of the stress, it takes up all the stresses that we go through during the activities of daily living. You see these muscles here, which are at the spinous level, and if you see these muscles at the spinous level, you will see that they pick up stress at every motion of the spine. And ultimately, the forces at the spine is distributed to the larger muscles from here. Now, if there is imbalance in the muscles of the spine over a period of time, then you will see that there's a factor we call it a stress factor that accumulates over the most mobile structures of the vertebra. We know that there's a curvature, and the curvature is here to take up the stress of the motion during any activities in the body. And normally the stress ends up at the apex of the curvature, at the apex of the curvature of the thorax, or the apex of the curvature of the cervical. When this takes place, then the muscles from both ends becomes imbalanced. When this imbalance takes place, then what happens is that there will be a stress on the disc of the vertebral column. Then over the period of time, this disc will give way and it will compress on the nerves and cause a slip disc. Now, before anything can take place, then we have to keep the muscles balanced. Now, what's very important here is that as long as the muscles are balanced in the spine, the stress factors will not develop. Transverse processes are the one which are closest to the stress that accumulates at the spine. Once these forces from wherever, the arms or the leg, encroaches the spine, they are distributed off to the small muscles. Some part of it is absorbed by the shock absorbers, which is the disc. But majority of the forces is then distributed to the muscles here. That's the reason why we get muscle aches over the period of time. To take away the stress and to balance up the whole spine here, we have this machine, which is a Shockwave machine, but it has got the elements of. And what happens is that when these muscles gets into imbalances both sides, it causes a lot of stress on the joint. Now, when we go to the gym, we stress ourselves further. When we do the sports, we stress ourselves further. So the force is added and added and added. We sleep less in life. So what happens is that we need to come here to get these muscles balanced up both sides so that we are able to identify first of all. Now, if you put this probe into the segment here and we just check the adjacent segment, we will be able to take that measurement first. For instance, now there's no muscles here, so you will get the measurement of the first vertebra, the thoracic bone. Then we have the second one. Then we have the third one. Then we have the fourth one. Then we have the fifth one. Then the sixth one. And as it goes on, we just keep on taking that the measurements on both sides, and after that we are able to identify one more here, and to identify ultimately the kind of pictures that we'll get. Of course, there are no muscles here, so we will have imbalances seen in both sides very badly. But if you put a subject, a human being here, then we will see a different picture. It's important to see the person sits in this position, but this is the most optimal position in which the segment opens up. When the segments are open, then the probe has a better picture view. So what happens is that, say for instance, we want to have the thoracic thing done again, and we will do the same thing now. This person has muscles and is well adjusted and well positioned, and we take these structures from both sides, and if we do that, we are now seeing the structures. This man has got all the muscles, and what is the reading now showing? Most of the best muscles are now slightly imbalanced towards the right side. So his left side of the muscles are a little imbalanced, and there's a muscle pool towards the right side, the left side, so the right side needs to be adjusted. So for instance, we say this one is quite well balanced. So we see the spine is quite straight, except for the last one where there's an imbalance. So I would like to suggest this one, this one, this one, this one, and this one. So when we do adjustments, then what happens is that the muscles on both sides are now to be balanced out. So when you do that, we have it 11, T11 here, we go down to T11, and we will then, this helps the muscles on both sides. What happens is that this sends a frequency of ultrasonic frequency with a piezoelectric effect into the muscles, and it allows the resonance of the muscles, equal resonance of the muscles have been put together, and that gives relaxation on those muscles. Similarly here, we have T and T3, we have T3 here, and we have T2 here. This way, we are able to now analyze him again. When we analyze him again, we will see a straight line. His muscles has been adjusted very, very well. So we have got a bell curve coming in now. The more the bell curve gets higher and higher, and if it's equal on both sides, we are able to get these muscles in line. And both the muscles on both sides will become balanced out. And that is the essence of this particular machine, which gives you the analysis of this. Now, if we have a person who have got, say, a trigger pain at the neck level or headaches for the matter, then we go back again here, and we go to the trigger points, and we will change this probe here and put the probes, which is a bigger probe, slightly bigger probe here, and we will then use this probe to hit him here, so that this probe's able to then send messages so that it releases the muscles. So you see that shape coming up. The more it gets in the bell shape, the better the muscles resistance are, and it's balanced. So we have got a lot of protocols on this machine which can deal with a lot of tendinitis, fasciitis, and any kind of pain that your person may have. We'll ask him a question. Boy, was it painful?
No.
There's no pain, huh? Can you tell the camera? Is it painful?
This is not painful.
This is not painful at all. So how do you feel when it just hits you?
Yes, very nice.
And comfortable, right? You feel a bit comfortable, right? Good. So this gives you an analysis of these muscles. At the same time, it also treats a person's problem area. So this is a machine which needs to be handled by a lot of physiotherapists, and we recommend physiotherapists to have these machines in their centers, so that it gives you an analysis and also balance up the muscles of the spine. So before a person goes to any sports and before a person goes into any activities to take up any sports or a gym or yoga for the matter, they come to get the balance of the spine done before they go and take up this. And it's advisable that it's done once a week to begin with for about 4 times. Then we can keep on doing this once in 2 months so that there is always balance taking place. With the analysis here, we are able to have a guided kind of therapy to the spine so that next time when they go into any kind of activity, they do not injure their spine. And we can prevent a problem to happen in the future. Thank you very much.